Well, the new year is here, and it's the perfect time to set healthy habits that will carry you all the way through 2025. One area that we may often overlook, our backs.
Our neck. Let me not go there, because we'll do it. With some of us working at a desk or even working from home, constantly staring at that screen, we're just kind of down here all the time.
Yeah.
Back health is super important, so we got Dr. Mehta with us today to give us a look at some healthy tips to move forward to make sure that our backs are healthy.
Yeah. Dr. Mehta, thank you so much for being here. I want to also point out the fact that you don't just have to be an adult. This can affect anybody, right? All ages, children as well. So talk about some of the reasons for back pain, and then we'll get into more of what you have to solve it.
Yeah, thanks for having me. Yeah, like you mentioned, I see patients from age 9 to 95. So back health does not discriminate by age, by gender, by race, anything like that. And so some big things I see are, people, like you said, not sitting properly or having the best posture, our diet, our sleep, our exercise routine. There's so many things that factor into our health and our spine health. And so I want to hit a couple of big things today that we can maybe work on in the new year.
All right, let's get into them. So what's your first tip?
So my first tip is nutrition, right? We hear it all the time, eat the rainbow or things like that. But nutrition is key. If we're eating processed foods that are fatty or high in sugar, those lead to inflammation, not only all over our body, but in our spine as well.
It's inflammation. That is the thing people should be looking forward to. Is there a certain diet? I mean, I've been doing keto for the last couple of days, and it's just changed my whole body. My knees are back moving again.
For sure, for sure.
Neck is moving.
That's a great question. So obviously, anything that we can do to eat more natural foods, but I actually have 3 specific foods that I recommend. So I recommend spinach, blueberries, and turmeric. And obviously those are very different foods, but those are really good foods to try to keep the inflammation down and keep our spines healthy.
Yeah, it really does make a difference. Pineapples are also pretty good, and ginger for anti-inflammatory.
And if you put all of those into a nice little juice or smoothie, you're good for the day.
I love it. Love it. So you got to take care of our nutrition too.
Yeah.
What else do you have for us? Tips and then some exercises.
Yeah, so maybe the next one we'll do a quick tip and then we'll finish off with an exercise.
Yeah.
So sleep is also very important, right? When we're sleeping at night, that's when our body's recovering, not only from an immune standpoint, but just all the recovery in our body. And so sleep is key. We were just talking before the break, but I try to get at least 8 hours of sleep at night because that's when my body can really recover. I know for you guys that might be a little harder because you're here before the crack of dawn.
Right.
But the more sleep we could get, and if we're getting restful sleep, right? So put those phones away an hour before bed, limit screen time, get a nice glass of water, but get good sleep, and that can really help. And really quickly, if you have back pain when you're sleeping, sometimes tucking a pillow beneath your knees or between your knees helps take that pressure off of your back. An ergonomic pillow may take that pressure off your neck and shoulders, so you get better sleep.
I have a thought to talk about. How important is it to change out your mattress and your pillows often, just as people get into a new year, there's another year that we put mileage on our mattresses. When should we change them out?
That's a great question, and I'm guilty of that as well. The adage is about every 3 to 6 months you want to flip the mattress, and then you also want to turn the mattress so you're using all 4 corners. But about every 3 to 6 months is the best time. Pillows, I would say maybe around the same time, but when your back or your neck are telling you, that's probably a good time to do it.
Yeah, you got 2 people in the bed or 1 person, you still need to change them out as much as you can.
Yeah. Can you show us one stretch exercise really quickly before we go?
Yeah, and actually you brought up a really good point. I think when most people think about getting up to stretch, they only think about bending forward and touching their toes. But your back isn't only responsible for forward and backward. So it's 3 quick stretches, but if you could do them all in 30 seconds, right? So the first one, we won't go through it, bending forward and touching your toes. The second one, you want to reach over and you want to twist your spine because you twist your spine during the day. And then the last one is maybe like a side-to-side stretch.
There we go.
And so that way you're thinking about your back in all 3 planes. We're not just going like this all day, right? And so you want to do all 3 stretches so you're really getting a comprehensive stretch.
Dr. Mehta, the man.
So much helpful information. We appreciate it.
Having me, guys.
Thank you very much. We appreciate you coming. Come back soon, all right?
Will do.
All right, Annie Mae, thank you. What you got going on?
All right. Thanks, Stephen.